In Gauteng, KwaZulu-Natal, migrants, including pregnant women, children, and the critically ill, are being physically blocked from entering public clinics and hospitals.
Okay, so basically what happened was we came here this morning. As normal, we are enhancing Section 17, where we are checking the identification of anyone that is coming to the hospital. We are only allowing the South African citizens.
Doctors Without Borders reports that anti-immigrant groups stand at the gates and inside waiting rooms demanding IDs, turning away anyone they suspect is not from South Africa.
As we know, these issues rise and fall in South Africa over time, but over the last couple of weeks we've been receiving a significantly increasing number of reports from people who've been unable to access really quite important healthcare. So last week we undertook an assessment in Gauteng to try to understand the problem better. We visited 15 facilities in total, and we found that more than half of them had physically blocking elements by anti-migrant groups who were preventing patients from accessing the care that they needed, which is obviously extremely concerning because they need to access this care.
Some patients have gone more than 2 weeks without HIV medication. Pregnant women with life-threatening conditions have been left unattended. And in some facilities, even healthcare workers have joined in.
Oh, okay. My name is Ponso from March and March. So since we started this thing, I think it's about 2 months now. But today morning, I was at home, and then people that who were here at the gate, they call us. They say back up. When you arrive here, there's a lot of police here outside. They are forcing those foreigners to enter here at the clinic. So Tina Masimela at clinic city Tina, we don't want any illegal, we don't want any foreigners. It's legal or legal or illegal. We don't want them to get a health service here.
Ladies and gentlemen of the African jury, today I bring before you a case, not of theft, not of fraud, but of betrayal. Betrayal of our constitution, betrayal of our humanity, betrayal of the sacred creed that says, I am because we are. Exhibit A, a 16-week pregnant woman in Gauteng, hyperintensive, in danger. She arrives at dawn, seeking care that could save her life. At the gate, a man waves his South African ID like a sword. Get out. The nurses laugh. The doors close. And the place built to preserve life becomes a place that withholds it.
We should be put first before the foreigners. Everything else before the foreigners. This is why places like this are overcrowded. And then we get left behind. We are entitled to everything first. Foreigners must go back home and go to their own hospital. Right?
Your Honors, the law is clear. Section 27 of the South African Constitution. Everyone has a right to have access to healthcare services. No one may be refused emergency medical treatment. The African Charter on Human and People's Rights, Article 16. Every individual shall have the right to enjoy the best attainable state of physical and mental health. These are not suggestions. These are binding obligations, and they are being broken in broad daylight. In 2008, over 60 were killed in xenophobic attacks in South Africa. In 2015, Mobs hunted migrants in the streets. In 2022, Operation Dudula blockaded Kalafong Hospital. And now in 2025, the scene has shifted from the street to the clinic. But the result is the same. Brothers and sisters turned away. Operation Dudula began as an anti-immigrant vigilante movement. In 2021, it spread Johannesburg, Cape Town, KwaZulu-Natal, raiding homes, chasing traders, blocking schools and clinics. And in this climate that they helped to create, we saw the murder of Elvis Nyapi in the absolute, burned alive, failing to show his purpose. Yes, burned alive for failing to show his purpose. What kind of society does that? Yes, there are grievances. Unemployment, crime, poor services. They are all real. But the evidence from the World Bank, from Stats SA, from the International Labour Organization, proves that migrants are not the cause. In fact, migrant businesses create jobs. The real thieves are corruption, poor governance, and policies that strangle opportunity. Surveys by Afrobarometer and Pew show dangerous attitudes taking root in South Africa. Many believe immigrants are a burden or cause crime without evidence. In the 2024 elections, the EFF, whose leader, Julius Malema, defends immigrants, underperformed at 9.5%, while anti-immigrant parties gained ground. This tells us something uncomfortable. Frustration is being channeled towards the wrong target. To those at the gates of the hospitals, I ask you this. What justice is there in turning away an HIV patient whose untreated illness may actually spread? What victory is there in denying a pregnant woman care, risking the death of both mother and child? Do you not see that in striking her down, you weaken the nation itself? If you must fight, fight the corruption, bleeding 150 billion rands from the public purse every year. Fight for better hospitals, shorter queues, and safety in your streets. But do not fight the powerless. Don't do that. Of course, many South Africans are not xenophobic. Many have risked their own safety to shelter migrants. But zero tolerance for xenophobia must be the law of the land, enforced in the streets, the clinics, the halls of power, everywhere. Healthcare is not a privilege, it is a right. And when you deny to one, you endanger all. Our borders were drawn in Berlin by men who never saw us as family. Today, when we turn on each other, we serve their design. We once fought together to topple apartheid, to end colonial rule, to reclaim our dignity. Shall we now surrender it over accents, skin tones, or passports? I ask you to return a verdict, not just in your minds, but in your daily lives and hearts. Reject xenophobia. Brothers and sisters, remember that an injury to one African is an injury to all Africa. We are family. We are one. We are Africa.